Got to move here because there's some news coming out on Gilead. Gilead Sciences out with some pricing news involving remdesivir. It's antiviral treatment. Our Meg Tirrell joins us now with more. Good morning, Meg.
Good morning, Joe. So remember that Gilead had agreed to donate its existing supply of remdesivir through the end of June. So now it is putting a price on that drug. The price for the United States is going to be $520 per vial, or $3,120 for the typical course of treatment. That is higher than in other developed countries, where the price will be $2,340 for the entire course of treatment. Gilead says that's because of the way the drug discounting system in the United States works. Nonetheless, whichever price you look at is lower than some were expecting, of at least $5,000 per course. Gilead says if it was doing its typical calculations on how to price a drug, and they priced it by how much they were saving the U.S. healthcare system, and remember this drug reduces hospital stays by 4 days, they said that would result in savings of $12,000 per patient. So they argue this is quite a discount. And they note that they believe they need to do things differently during a pandemic. They said they needed to be guided by that principle. They said, as the world continues to reel from the human, social, and economic impact of this pandemic, we believe that pricing remdesivir well below value is the right and responsible thing to do, guys. But the fact that they are pricing it differently in the U.S. than other developed countries probably going to raise some eyebrows. Back over to you.
Hey, so Meg, I'm trying to figure out whether dexamethasone is a competing drug and whether that had any influence on where this is priced. Would it be used in different settings? Is it used at the same time? Dexamethasone seemed like it had better actual efficacy, but I don't know if there's been comparative studies done. But are both being used on the sickest patients?
That's a really great question, Joe. So dexamethasone, in a perfect world, dexamethasone would be used for the more severe patients, and remdesivir would be used earlier. But because of the lack of so many things available and the fact that remdesivir is administered via IV, it's given to patients who are pretty sick already. But generally, it's thought that remdesivir will work better earlier in the course of the disease. But your question is really acute because a drug pricing watchdog called ICER actually put out a new estimate of what remdesivir should cost based on the fact that dexamethasone worked so well. And their estimate came down to $2,500 to $2,800 from $4,500 to $5,000 if dexamethasone's results bear out longer term. So that does potentially play a role in the way people are thinking about this.
Becky.
Hey, Meg, this open letter from the company, obviously Gilead realized that there's going to be some serious scrutiny coming from this. The idea that private health insurers in the United States will pay more than developed country governments. What kind of firestorm do you expect, and what kind of pushback do you expect, or do you think they've laid out enough about why they got to this level and that they've kept it lower than had been anticipated? Will that be enough to make sure that it quells any kind of pushback?
I'm so interested to see what kind of response we see to this, Becky, particularly from the U.S. government. I mean, before the pandemic happened, drug pricing was a huge issue. It was the biggest issue for the drug industry. And the fact that the U.S. pays so much more for its medicines than other countries, this is a prime example of the U.S. paying more for its medicines than other countries. And Gilead will use it as an example to explain why the U.S. drug pricing system is so complex and why drugs cost so much more here. It's just going to be a fascinating morning, I think, to see the response to this.
Hey, Meg, in terms of total cost for every hospitalization, and that I was sort of trying to do the larger math on this, based on the letter that Gilead sent out, they're estimating that each day that somebody's in the hospital for COVID, it's costing about $3,000. I don't know if that's inclusive of remdesivir. Also, as we know, a lot of patients are being given remdesivir in combination with plasma. I don't know what the cost of collecting that plasma is and then delivering that plasma. Do you have any estimates on for every hospitalization related to COVID, what it costs, and then we can try to extrapolate out what that means for the larger costs for society in this country?
I don't have that on hand. I know it exists, and analysts have been parsing through that, particularly to find what the reasonable price of remdesivir should be. And when Gilead says $12,000, they're probably taking all of that research into consideration. I don't know if it includes plasma. That's a great question. But we know hospital stays, of course, are very expensive. So the fact that this does shorten hospital stays is important. And also, of course, just for freeing up space as more people get sick and go into the hospital.